Thank you very much for the opportunity to speak at this year's Asia Healthcare Innovation Summit, and a particular thanks to Andrew McCarthy at Brink for this opportunity. My name is Dr. Marten Brelen. I am an associate professor working at the Chinese University of Hong Kong, and my talk today will be on COVID-19 digital health passports using blockchain technology. It's now well over a year since the World Health Organization announced COVID-19 as a global pandemic, and at the time of recording this presentation there have been over 155 million cases globally, resulting in approximately 3.25 million deaths. And here locally in Hong Kong there are just shy of 12,000 confirmed cases and 210 deaths due to COVID-19. And we're all, of course, trying to do our part to stop the spread of the virus and return society to a new normal. And we're doing this through socially distancing ourselves, wearing a mask when we go out into the public, and washing our hands more frequently. And more recently, in the last few months, vaccinations have become available. And in Hong Kong now, 12.8% of the population are fully vaccinated, having received 2 doses, and more than 2 million doses have been administered. These are given in community vaccination centres, which are spread throughout of Hong Kong, and upon vaccination, every individual will receive a paper-based certificate of vaccination, and if they give consent, they can also have their data stored on the eHealth app, which is run by the Department of Health. There's been a lot of debate and controversy surrounding COVID-19 passports in the media. I strongly believe it is the best way in which we can show validated proof of vaccination and our recent COVID-19 test results, as well as potentially in the future our immunity, to allow us to reopen borders, start travel again, have safe access to bars, restaurants, public buildings and hospitals. What we know is that paper-based vaccination cards are not going to be the way forward. They can be easily forged, and there are even reports now on social media of people buying fake COVID passports. There needs to be a digital version of COVID passports. However, the current solution uses centralized storage for handling, storing, securing and distributing your private health information, or PHI, as well as your personal identifiers. And this, of course, has serious privacy concerns. The other issue with storing data in a centralized legacy server is that there is a single point of failure in this system, as was demonstrated quite recently in the UK when 16,000 COVID-19 test results were lost because they were kept on a simple Excel file that was unsecured on a single server. I believe the best solution to solving the issue of COVID-19 digital passports is to build them using blockchain technology. Blockchain technology works in a different way in that it's a distributed ledger which is distributed over a set of nodes. These nodes are essentially computers, servers and data centers that are connected on a network. Each node has a complete and updated record of the ledger, such that if any individual node should be compromised, then the data is still secured by the other nodes on the network. So it's very different from the centralized storage solutions where loss of data and hacking are a serious concern. What's more, on blockchain, the data on the chain remains immutable, meaning that once the data is written to the blockchain, it cannot be altered. And the data is trustworthy because it is validated using assigned validators to sign all the transactions that are written to the chain. Every time a new transaction is recorded on the blockchain, it's time-stamped, meaning the exact date and time of each transaction is also recorded. This means that the entire data is transparent, auditable, and traceable. It's also extremely secure. The data is secured on the blockchain and encrypted using cryptography. And to date, there have been no reported cases of anyone being decrypt maliciously any data stored on blockchains. What's more, there are no personal identifiers ever stored on the blockchain. So even if the data became available, there is no way to be able to know whose data that belongs to. All data on the blockchain is assigned according to the public key of the passport to whom that data belongs. And I think one of the most strongest utility cases for blockchain technology in healthcare is the peer-to-peer nature with which data can be shared. Everyone keeps privacy as well as self-sovereignty of their own data. That means that they keep control of their private health information, and they are in control of when that data should be shared with another person on the network. If an individual requests the data to be shared, it's up to each and every one of us to decide whether we want to and consent to sharing that data. And the sharing of data occurs in an entirely peer-to-peer manner. There is no centralized authority that needs to be involved to oversee that transaction. So a few months ago, we set about trying to build a COVID-19 digital health passport with the aims of having verifiable data immutably stored on a decentralized distributed ledger, with the key components of maintaining privacy of every individual and every individual maintaining self-sovereignty of their data. The data should be trustworthy with open and transparent authorship to see who wrote the data onto the chain, and an entirely auditable and traceable data of the on-chain transactions. This was no mean feat, and we needed to build a consortium of specialists to build this solution. Myself, as the principal investigator and project lead, runs the project from the university standpoint. The project is entirely at this stage funded by university research grants. We were very fortunate to be able to work with Consensus, and for those of you who know blockchain technology will undoubtedly know who Consensus are. They are the leading Ethereum enterprise blockchain development company globally. They have a tremendous track record in building banking solutions for blockchain as well as CBDCs for governments. And this has been tremendously helpful for us to build a healthcare solution based on the same blockchain technology. The front end of our passport has been assisted by Forms, which is another Hong Kong company who designed and built the front end application, the user interface as it were, for both the iOS and the Android apps, as well as our administrative portal. And this sort of computing architecture requires very complex cloud computing. So we've had the technical expertise and support from AWS Hong Kong in the development during this project. The application itself is actually quite straightforward, and I think it can be summarized just by this screenshot of the homepage or dashboard of the application. As you can see, every individual will have access to their own on-chain data, including their COVID test results, whether they are PCR or antigen test results, their vaccination status, which has been written to the chain from a verified healthcare professional. Immunity testing, all these serological tests are also stored on-chain and will be useful once we establish a little bit more how immunity works following either COVID-19 infection or after vaccination. There is also an opportunity to use the passport to record daily temperature checks, and in the release one these need to be manually entered, but it's certainly possible in the future to interconnect IoT devices that record daily body temperature checks and uploads the data automatically to our blockchain. There's a very important component when sharing private health information that revolves around consent. And in the application, we've explicitly written in to the program the process of consent. And as you can see from the video on the right, every person has to log into their individual passport. And upon opening the passport, they won't be able to show their QR code until they've given explicit consent. So there is a process involved with providing consent until the QR code is shown, and then that QR code can be scanned by other individuals on the same platform to obtain that individual's COVID-19 data. The scanning of a passport is equally as simple. Every individual has the Medoxi passport. They open the passport, and built into it is a QR code scanner, which they can use to scan somebody else's passport and then have a snapshot of their COVID-19 data. Once they have seen the data, they tap anywhere on the screen and the access to that person's passport is automatically revoked. There is the opportunity, and we have written into the program, the ability to keep contacts. So if you're members of the same family, or if you work together, you can set up a contact list, which again keeps access to each other's passports open, and likewise can be revoked at any time point. We'll see in the future whether this is a feature that people actually want. Adding data requires healthcare providers and laboratories to sign and validate the on-chain data. So in our platform, we have certificating authorities which are able to onboard healthcare providers as well as laboratory staff to be allowed to write the data onto the chain. It's done through exactly the same application. And the certificating authorities can be, for example, the medical directors of hospitals, people in charge of clinics, and CEO of laboratory companies that could then assign their staff to be validated to write on-chain data. The on-chain data provides a means by which we can track the authorship and signature of all the recorded data on-chain, which provides accountability and trustworthiness of the data that is written to the blockchain. We have here an example which on the right shows you the inputting of a COVID test result by a healthcare provider. And on the left, you can see our Block Explorer. A Block Explorer is simply a means by which we can monitor the transactions going through our blockchain. So on the right, the healthcare professional is choosing what type of test for which individual, at what time, and what result needs to be uploaded to the chain. And once they've uploaded that, you will see a transaction being submitted onto the chain, and you can see that being submitted to remain immutably there forever on our blockchain. The application itself is now production ready, and the next stage for us is to run this as a clinical trial. So we have received the Institutional Review Board from the North Territories East Cluster Ethics Committee, as well as the approval from the Department of Health to be running this passport as a small clinical trial in the community vaccination centre that is set up at the CUHK Medical Centre. This clinical trial is due to start this week, and it will allow us to onboard the first individuals to try our COVID-19 digital health passport. It will allow us to get feedback from users, but more importantly also allow us to test the system in a beta testing form before releasing it out to the public. There's been a lot of debate here in Hong Kong about all the various COVID applications, and I wanted to summarize briefly how COVID-19 passports fits into our local infrastructure of various applications. We have here something called the e-health passport, which is essentially an electronic patient record. It allows the Department of Health to keep in a centralized legacy server data that relates to you, not just for COVID-19, but any medical condition. It's limited by its usability of being able to share that data. You have a limitation of only being able to give access to 3 other healthcare professionals to have access to your medical records, and therefore isn't necessarily a passport as such. There is also a contact tracing app called Leave Home Safe, which allows you to record where you've been at what times of the day, such that if you were in close contact to someone who has COVID-19, then you will be contacted to go into quarantine. This again obviously doesn't work as a passport. Within the public hospitals, the hospital authority, there is a chatbot available for us to use, to essentially use a natural language processing AI chatbot to upload test results for COVID-19, as well as being able to record and also retrieve our vaccination status, but it's unique to a system just used within hospitals. And there's talk of an electronic vaccination and testing record system being set up in Hong Kong. However, it's not currently in widespread use. Certainly won't be using distributed ledger technology, and we'll have to wait and see how much traction it gains in the future. So the roadmap for us with our startup called Medoxy is essentially that we're building now a number of applications in parallel. Our showcase and our best utility at this stage is our COVID-19 blockchain passport, and we have big ambitions to develop a network effect for this passport, namely to onboard enough people that it gains utility and real-world usage. But we're also in parallel to this, having various other grant applications either submitted or being prepared for developing a range of other blockchain healthcare innovation systems. And in particular, one of the things we want to add for the future is something called IPFS, which allows us to store bigger sets of data in a distributed manner. We're also, of course, looking for investments, and being a blockchain startup, we are particularly keen to explore some of the more modern techniques of investment strategies involving setting up governance tokens as part of a DAO or a decentralized autonomous organization, where investment comes in and is tokenized on the blockchain, allowing people to have a governance, so having a say in how the startup should be run, and having voting rights within the startup. And then when the governance token hopefully succeeds and gains value, these tokens can be sold in order for investors to receive the rewards of the increase in value. We also need in the future a payment platform on the Medoxy blockchain, and this will inevitably involve us incorporating stablecoins. So right now, our healthcare structure, our innovation of a medical blockchain technology can be summarized as follows. There is a bottom layer, which is our blockchain. We are using the Hyperledger Besu blockchain, which runs on the Ethereum network. It's a hybrid blockchain allowing both private and public blockchains to run in parallel. At the moment, we are using just the permissioned blockchain for running our COVID-19 passport. Consensus have built for us the next layer, which is called Codify Orchestrate, which is the layer that allows the API calls to be sent to and from the application down to the blockchain. And the top layer, layer 4, is where our applications sit. And at the moment, our one production ready application is our COVID-19 passports. But essentially, going forward, any application that runs within healthcare that requires multi-party, time-stamped approvals and signatures could be run on exactly the same blockchain, simply needs the addition of a new application layer at the top. And we're looking at developing healthcare insurance, electronic patient records, e-prescriptions, supply chain management for pharmaceutical and medical devices companies, IoT integration with medical devices, recording data directly onto the chain, and particularly relevant now during a pandemic is having a decentralized telemedicine platform, which can also be run on blockchain technologies. So there's huge scope for us to develop future applications using the same infrastructure that has already been built. We'll be able to onboard people faster, the more utility and the more applications that we have running on our Medoxy platform. I think the time is probably running short, so I'd like to thank you all for your time and attention. I welcome anyone to be in touch. We are open to collaborations, to suggestions, to investments. So all of my contact details are on this final slide. I thank you all for your attention, and I look forward to the live Q&A, which will be taking place immediately after this presentation. Thank you.